body to cover after workouts, so you aren't all sore when you have to work out the next day, if you're a serious athlete and whatnot. Liquid meal replacements that can help you gain or lose weight, so like protein shakes and stuff, and melatonin, which helps control your sleep cycles, so you get that rest, so you get that extra push you need the next day.
Alright, we go PEDs, steroids, and it raises testosterone level and gain muscle mass in a short period of time. HGH is human growth hormones, boosts muscle mass and helps reduce the fat from the body. Now, IGF-1 is insulin-like growth factor. It causes a significant growth and measures to help cause growth abnormalities, and it monitors treatment of growth hormones deficiency and excessives. So, oh yeah. Blood doping, it improves oxygen capacity through the athlete. The belief behind blood doping is that the extra blood cells will deliver more oxygen and other elements to the athlete's muscle tissue, which means more stamina and endurance.
A lot of people wonder if there is a difference just between using PEDs and just doing the actual work and the actual training to get the muscle mass. And the answer to that is yes, there's a very big difference between just training and working out on natural terms and then using a performance-enhancing drug. Using a performance-enhancing drug does exactly what its name tells. It enhances your performance, whether it's through mass and building muscle, or if it's just other things like that, or you're mentally. And a big difference is the health risk involved. When you train naturally without PEDs, then your risk for injury and other things like that, it's way lower than if you do use the performance-enhancing drugs. And also, athletes that do have to take PEDs aren't as good as athletes that don't have to, because they're cheating to use a way to get up to all the other athletes' level of playing field. So it's really not fair to anybody. Also, the history of PEDs has gone a long ways back. It started around 100 AD, and the gladiators in Rome, they used to take a form of PED. It's like a leaf that they used to eat, and it'd give them lots of strength, and it'd make them less tired, or not less tired, but prevent them from getting fatigued. Around 1928 is when the first PED incident came into the Olympics, and then in the 1940s in World War II, Hitler started testing performance-enhancing drugs on some of the prisoners that he captured. So that's when the performance-enhancing drugs really made a growth in research and development with that. In 1958, the FDA approved some performance-enhancing drugs for the United States to be sold and licensed, and nowadays you can't get the types of performance-enhancing drugs without a medical prescription. And then 1960, Newt Jensen died from an overdose in the Olympics, and this was the first case that was really documented that was strictly because of an overdose of a performance-enhancing drug. And this was a really big deal as well, because it was an Olympics, so it's national news everywhere on the worldwide. In 1988, Ben Johnson was the first one that got really caught in the Olympics, and because he was caught, all the medals, the gold medals that he won, he was a track athlete, and they were stripped from him for using this performance-enhancing drug.
Alright, reasons why PEDs are used: to help build muscle mass and increase oxygen delivery. It also helps weight loss and masculine pain, relieves stress, and one of the biggest reason is the competition level. Players aren't as good as other players, so they choose a easy way out and try doing it faster with using these drugs. Major sports affected by PEDs are baseball, hockey, rugby, soccer, football, cycling, wrestling, and track and field. And one that's not really a sport, it's like an activity event or whatever, is powerlifting, which is the most common they use. So,
What are PEDs? They are performance enhancing drugs that we have said, and Barry Bonds is the poster child of performance enhancing drugs, if you guys didn't already know. So different types of PEDs are anabolic agents, which include steroids, peptide hormones, growth factors, and other related substances like that, diuretics, stimulants, beta blockers, and human growth hormones, more commonly known as HGH.
Alright, so the first one was anabolic agents, and they're used to treat delayed puberty, so accelerate that, and impotence. And then it'll fight muscle wasting diseases, and an example of that would be like HIV.
Some physical effects of the anabolic agents are acne becomes really bad, especially on your back. Male pattern baldness, so that means that you're obviously just going to lose your hair and become bald. Liver damage, the liver takes out all the bad things and diseases that go through your system. That's what the liver does to purify. So with all the performance enhancing drugs, it's not normal for the liver, so it tries to take it out, but when it takes in all the bad things, and it ruins your liver. Premature closure of the growth centers, so that deals with like the growth plates in your bones. So you'll see a lot of people that take steroids or HGH or another form of performance enhancing drug. They take one of those in high school, and they'll become short for the rest of their life. Stunted growth, yeah, pretty much being short, like I just said, and disruption of puberty in children. That just means that when normally you go through natural biological changes through puberty, that's when you take a testosterone or another form of something that changes you like that, then it'll throw off the levels in your body, and it'll change it. Some more physiological or psychological effects is increased aggressiveness and sexual appetite. So this is, you heard of like roid rage, when people their mood swings change a lot. That has a lot to do with performance enhancing drugs, because all the hormones that are inside of you are off balance. And depression and sometimes suicide is a major side effect of this as well. And I don't know if you guys know, but a couple weeks ago in the news, a guy actually just died, they think, from steroids. He played for the NFL. And so that's a really big problem with taking all these performance enhancing drugs, that they'll get in your head as well.
Peptide hormones and growth factors. These are things that are used to treat cancer and aid those who have been born prematurely, to get them better and whatnot.
Some physiological effects of those are palpitations, and those are just like irregular heartbeats. You got headaches, sweating, nausea, muscle cramps, and nervousness.
Diuretics are used to treat hypertension, kidney disease, and congestive heart failure. And some of the side effects of these are palpitations, which are like irregular heartbeats, headaches, sweating, nausea, muscle cramps, and nervousness, because it probably messes with your kidneys a lot. And some other effects are dehydration, muscle cramps, dizziness or fainting, drops in blood pressure, loss of coordination and balance, and sometimes death. Because, like I said, it probably messes with your kidney, and you can't live without your kidney. Please. Not me either. Actually, that's way up there.
Oh, wait, I think I'm going to slide out. Alright, there you go.
Alright, stimulants. A stimulant is referred to a group of drugs that boost alertness and physical activity by increasing the heart rate and breathing rates through the brain's function. By acting on the central nervous system, stimulants can stimulate the body both mentally and physically. And it helps treat It treats ADD, ADHD, asthma, narcolepsy, and obesity. Also, stimulants, the athletes use it because it helps increase the ability to exercise at an optimum level, combat tiredness, and suppress appetite.
Some psychological effects of stimulants, some of insomnia, where you can't sleep because, like Mikey said, if you're trying to combat tiredness, then once you actually do need to sleep, you can't sleep because you're so wired. Anxiety and weight loss, when you get really hyped up like that, sometimes people think too much and they get nervous and then they don't want to eat and everything. Dependence and addiction is a big part of this as well, because it's almost like a high. Once you get the feeling that you're on that stimulant, then your body needs that to keep on going, otherwise it feels like it's going to crash. Dehydration and tremors are also a big part of this, because your body really does need the sleep that the stimulant is preventing it from getting. So even though you don't feel tired, your body really needs that sleep. Increased heart rate and blood pressure is also a big one of these, because when you stimulate your heart, it obviously beats way faster than what it should be. So you have and if that's kept up for a long period of time, then that's a really bad risk. And also, because of the heart rate and high blood pressure, heart attacks and strokes are a really big part of this danger as well. Beta blocker is another type of performance-enhancing drug. This mainly controls hypertension and relaxes patients or the people that take them. Cardiac arrhythmia is where your heart does weird things with the beta blockers as well. Severe chest pain is also a side effect of beta blockers because of the heart conditions that it induces on people. Nervous or anxiety-related conditions such as like it said, the hypertension, and that it'll come out in different ways through the body. So that's what beta blocker does.
Physiological effects of this drug is lowered blood pressure, slow heart rate, sleep disorder, and spasms of airwaves.
Human growth hormones, or HGH, pretty much have the same uses as anabolic agents, so you can put on a lot of muscle mass and, get bigger and faster and whatnot. And if you want to see a prime example of HGH, you could go to the Y sometime and just look at some of the people in there, because you can pretty much tell who does it, because, they got those belts, they're usually lifted in a white beater, they look a lot bigger than they should be. Think about it. And some of the physiological effects of HGH is severe headaches, loss of vision, acromegaly, diabetes, and tumors, and crippling arthritis. So you shouldn't do HGH, because one day you're going to have diabetes and tumors, and you're not even going to be able to use those hands that you got so strong with and whatnot, because they're going to be all twisted, and like their grip is just going to be torn up. And okay, yeah. Next slide.
I did that.
Okay, you got that. Some of the effects, just like, summing up of the body that all these agents have, are acne, oily scalp and skin, balding at young ages, and tendon rupture, heart attacks, and roid rage, and mood swings, and bad cholesterol. So you really don't want to do all these, because you're going to be walking around, and if you're lucky enough to still have your hair and not be bald from it, it's just going to be all greasy and just gross looking, and you're going to have acne all up on your back, and nobody likes acne on their back. You sit down and it's just painful or whatever, and you're just going to be having mood swings. Nobody's going to be around you, because you're just going to be freaking out all the time, or you're going to be that one creepy guy who's hitting on every chick, because I'm going to get to this in a minute. And, your doctor's going to be mad at you because you're going to have bad cholesterol. You're not going to be able to eat all the good food you like anymore. It's just really a terrible thing. It's not worth it. I mean, unless you actually take these things and make it big and get to the NFL and don't get caught and make that money. And some of the effects that are, only to men are you develop breasts. So you're going to have what women have. And you're painful erections, which you're gonna have all the time because of your like, you know, overdeveloped sex drive, and you're gonna hate that, and you're gonna become infertile, and that's what the pitch of the sperm is for, because your guys won't swim right, right, and then you're not gonna be able to have kids. And your testicles are gonna shrink too, so that's gonna just like your whole like thing with opposite sex is gonna get messed up because of these drugs. Women aren't safe from these drugs either. Women athletes, you know, some might take them because they want to be good. I wouldn't do that either. You're gonna be getting a lot of hair from places other than your head that you don't want to be there. You got a beard, you know, more than me and Logan's beard. No girl wants a beard. Your voice is gonna be all deep, you know, and James Earl Jones sounding. Gonna mess up. You're gonna have your sex drive is gonna be off the wall too, because you're gonna have an enlarged clitoris, and then you're just gonna be going crazy after all the guys. People aren't gonna be around you really, because there's some bearded lady coming at you. Breasts are gonna be smaller, and I don't know. I ain't even gonna go into that. And you're gonna have, if you have babies, the drugs are gonna affect them too, and they're gonna come out all ripped. Pretty much.